Hey, what's up, America? Rite Aid is closing permanently now. So this will be the second time that Rite Aid's gone through a bankruptcy, but this time it looks like it's pretty much over with. About 690 stores will be closed, and the pharmacy prescriptions say that they can be transferred to CVS, and I'm not sure about Walgreens, but I've heard CVS. So yeah, you'll pretty much be able to get your prescriptions if you're with Rite Aid through other pharmacies, but this is pretty much a done deal, and it looks like around 690 stores, like I said, are pretty much going to be gone. That's it. And so they filed for bankruptcy, they recovered, and now they're filing again saying they can't get out of the financial downturn, and this is it for them. So this is just another group of businesses that are starting to go out. Don't worry, a lot of businesses in retail are starting to go out of business and fail, but overall, we're still seeing a great deal of it continue. We're just seeing an acceleration of businesses going out of business that we haven't seen in quite some time.
CVS is moving forward with closing all locations in Arkansas after the state banned PBMs from owning pharmacies. They only have 23 locations there, but it proves where these companies make their money. Before the bill even passed, they were running ads telling everybody that if the state moved forward with the legislation, they were going to close all their stores. There was never even a whisper of them considering stopping PBM operations. They threatened that people would lose access to care if they couldn't own pharmacies and PBMs. But when it came down to it, they chose to be a middleman rather than a provider. That speaks volumes. The middleman has wrangled complete control from the people who actually provide care, and they are squeezing them dry. Without ever touching a medication, they are still capturing 31% of each prescription, according to the HHS. Now, independent pharmacies in the state have a chance to fill some gaps, but with CVS still controlling every aspect of care, it's going to be a tough process. I also haven't heard anything about Express Scripts or Optum, who are definitely doing big business in mail order in the state. I guess we need to get licensed up there and do our part.
So Walgreens is set to close down 1,200 of its locations. Walgreens Pharmacy. CVS has already closed 900 of its locations between the years of 2022 and 2024 and is set to close down 270 more. Okay? Rite Aid has been bought out. They've 810 of their stores have already been bought by a private buyer, and they're looking to close 316 more. All the major pharmacy retailers shutting down, filing bankruptcy. And I can't help but think about who keeps pharmacies in business. Their main clientele. Sick people. And then last time I checked, there's always sick people. There's always sick people. Pharmacies closing down and mass closings should be just as alarming as if the hospitals were to start closing down in mass closings. Because what do you mean? What do you mean you don't have the clientele when there's always sick people? So I decided to do some research. A CDC publishing in 2024 based off of the National Health Interview Survey data states that 8% of Americans are uninsured, as in 8% of Americans do not have health insurance, okay? And then an estimated amount of 27.1 million Americans of all ages are also uninsured. They do not have health insurance. So now everything is starting to make sense. If your clientele, the sick, are uninsured and they don't have the funds to make out-of-pocket expenses for their health, guess what? You have no business.
Hi guys, welcome back to my channel. In today's video, we need to talk about something that's happening all across the US. Pharmacies are closing down. I'm talking about the big names you see in almost every city: Rite Aid, CVS and Walgreens. These stores are shutting their doors, and for a lot of people, it's creating real problems. It's not just about losing a place to pick up your medicine. It's about losing access to healthcare in your neighborhood. If you're coming across this channel for the first time, my name is Rosemary. Kindly consider subscribing, give this video a thumbs up, and let me know your thoughts in the comment section below. Before we get to the video, let me play a few clips on the same, and I'll be back with my commentary. All credit goes to the original creators of these videos.
Pharmacies here in the United States are shutting down at an alarming rate, and this is causing many Americans to panic. Today, we're going to address what is going on, why these pharmacies are shutting down, and what this means for you and I moving forward. Specifically, how are we supposed to get our medication? In the past about 2 to 3 weeks, I've been getting a lot of comments every single day from people asking about the pharmacies and telling me their stories. One person told me just the other day that she has to travel about 45 minutes, and this is by bus. Okay, she doesn't drive, she can't walk, she travels about 45 minutes to get to the nearest pharmacy. It's about 20 miles away. Again, she travels by bus. But again, more and more pharmacies are shutting down. And as they do, it becomes a greater problem for us here in the United States. Just look at this. It says CVS is closing 270 stores nationwide. This article just came out the other day. But there's another article. That's just CVS. Look at this one. This one came out the other day as well. More than 300 Rite Aid stores now slated to close. So 270 CVS stores, 300 Rite Aid stores. They're not even the biggest pharmacy. Walgreens is. Walgreens is going to close hundreds of stores this year. Just so you know, Walgreens is expected to close about 500 stores in 2025 alone. That means 500 from Walgreens, 270 from CVS, and 300 from Rite Aid. That's over 1,000 pharmacies that are closing here in the United States. That's an issue. Specifically for people that have to drive to 20 miles, okay, 45 minutes to go get one prescription, which could be something that is actually keeping them alive. Now I want to show you something though. This right here is from the White House. It says, fact sheet, President Donald Trump announces actions to put American patients first by lowering drug prices and stopping foreign free riding on American pharmaceutical innovation.
Let's start with Rite Aid. This company has been struggling for a while right now. In 2023, they filed for bankruptcy. And then in 2025, they tried to fix things by closing some stores. But now, in 2025, they have filed again for bankruptcy. And this time, it's bad. They are shutting down more than 360 stores. That's almost a third of all their locations. People who depended on Rite Aid for prescription, flu shots, and even basic things like cold medicine are now left with nowhere to go. CVS is also closing stores. They started downsizing back in 2022 and have already shut down nearly 900 locations. This year, they are closing another 271 stores across the country. CVS says it's doing this because of changing shopping habits, like more people ordering prescription online using delivery services. But the truth is, not everyone has access to those services, especially the elderly people and those in rural areas. Walgreens is going through the same thing. They have been cutting costs and quietly closing hundreds of stores. Over 1,000 locations are expected to be shut down as part of a nationwide restructuring plan. And this is not happening slowly. Some stores are closing in just a few days' notice. Customers walk in 1 week and by the next week, the lights are off and the shelves are empty. So why is this all happening? There are a few reasons. First, these pharmacy chains are making less money from prescription drugs. Insurance companies and pharmacy benefit managers are paying less for each prescription. That means less profit for pharmacies. On top of that, online companies like Amazon are offering cheaper prescription delivered right to your door. That kind of competition is hard to beat. Second, shoplifting and theft have become a major issue. Walgreens even admitted that theft was costing them more than they expected, especially in cities like San Francisco. These stores spend a lot of money trying to prevent losses, but not always enough. So some companies are choosing to just shut down stores in areas where theft is high. That it's all about numbers. These companies are cutting stores and trying to make their investors happy. Closing quote-unquote underperforming stores means they can save money, increase their stock value, and focus on more profitable services, like opening in-store clinics or investing in digital healthcare. But let's talk about the impact, because this is where things really hit home. When a pharmacy closes in a neighborhood, it creates what's called quote-unquote pharmacy desert. That means people living in that area no longer have easy access to medicine, vaccines, or even just over-the-counter painkillers. Some people now have to drive 30 minutes or more just to get a prescription filled, and for folks without a car, this can become even more devastating. It hits hardest in low-income communities and communities of color. These are areas that already struggle to access good health care. Now, losing a local pharmacy just adds to the problem. It's not just about buying Tylenol. Many of these pharmacies also offer blood pressure checks, diabetes care, and even mental health services. Losing that resource can lead to worse health outcome over time. And let's not forget the workers. Each closed stores means dozens of people are losing their jobs. Pharmacists, techs, cashiers, managers, some of these people have worked there for years. Now they are being let go with little notice. And in some areas, there aren't many jobs opportunities to fill locals. Some companies claim they are replacing these closed stores with better services like in-store clinics or online platform. But again, not everyone can use those services. Older people might not be comfortable with telehealth. Poorer households might not have reliable internet, and rural areas might not have clinics nearby at all. So what's the solution? Honestly, it's complicated, but one thing is clear. Local, state, and federal government need to set up. They need to invest in community health and make sure everyone, no matter where they live, has access to basic services. That might mean supporting small independent pharmacies or creating mobile clinics that can reach underserved areas. At the end of the day, these closures show just how fragile the health system really is. One by one, these stores are disappearing, and if we are not paying attention, millions of people will be left behind. So the next time you see a pharmacy close in your area, know that it's not just a business decision, it's a warning sign. Let me know your thoughts in the comment section below. Thanks for watching. I'll see you in the next video.